For our Orgo project, we researched Adderall. I'm Meredith Robinson, and my partners are Lathan, Flake, and Riley Thomas.
Adderall is made up of amphetamine. Amphetamine structure is made up of a benzene ring with an amide substituent group. Its IUPAC name is 1-phenyl-propan-2-amine.
Adderall is a compound made up of a blend of amphetamines, 75% dextroamphetamine and 25% levoamphetamine. Dextroamphetamine has S rotation with its methyl group on a wedge bond, and levoamphetamine has R rotation with its methyl group on a hatched bond. They are the same structure with the same components, however the different rotations make them enantiomers. The different chiralities of the molecules are important because it changes their connectivity to receptor cells, changing the way the body reacts to the chemical.
The physical characteristics of Adderall. Adderall has a melting point of 11.3 degrees Celsius and a boiling point of 202.9 degrees Celsius. This compound is slightly soluble in water and readily soluble in acids. Additionally, it presents a strong odor that is consistent with that of an amine.
The history of Adderall. Amphetamine was discovered in 1910, but it wasn't synthesized for use until 1927. It was first placed onto the market in 1935 as a treatment for narcolepsy as the drug Benzedrine. Beneficial effects on children with behavioral problems was first reported in 1937. Dextroamphetamine was used on its own without levoamphetamine in a drug called Dexedrine. In 1946, 150 million Benzedrine tablets were used among British and American soldiers in World War II.
In the 1970s, studies were done finding that both isomers of amphetamine, dextroamphetamine and levoamphetamine, were effective in treating ADHD symptoms. In 1996, the drug Adderall was introduced as another primary form of ADHD medication.
Adderall is known to aid in the management of attention deficit hyperactive disorder, also known as ADHD. By controlling the levels of various chemicals in the brain, Adderall is able to help increase focus and control behavior. This is the result because Adderall is among the amphetamine and dextroamphetamine groups of chemicals which act as stimulants to the central nervous system. Additionally, Adderall is used to treat obesity as well as narcolepsy. The stimulation that the drug provides helps individuals stay awake and can also be used as an appetite suppressant. Side effects of Adderall include appetite loss, dry mouth, headaches, trouble sleeping, etc.
The most widespread inappropriate use of Adderall is among college students for assistance with studying because it is said to help with focusing and staying awake. No rise has been seen in Adderall prescribed to 18 to 25-year-olds because it's thought that they are getting them from friends and family members with prescriptions. These groups need to be aware of the serious adverse effects that can come from addiction to Adderall. The long-term effects are not clear right now.